If you're researching Medicare and looking for a video to help you understand Medicare Advantage plans and if they're the right choice for you, this is the video you need to see. So stay tuned to Medicare Advantage Plans Explained. Hi, I'm Matthew Claassen with MedigapSeminars.org. We are an independent insurance broker helping people with their Medicare and retirement needs from Hawaii to Virginia and Alaska down to the Florida Keys. We represent our clients' best interests, not that of an insurance company. Best of all, our services are free to you, the consumer. All you need do is ask. While most of our business is with Medicare supplement plans, we do work with and may recommend a Medicare Advantage plan, but only when appropriate. So this video is different than other videos you may have seen on Medicare Advantage plans. I'm not going to simply describe a Medicare Advantage plan. Rather, the intent of this video is to give you the information that you need to decide for yourself if a Medicare Advantage plan is right for you. As you know from my Medicare Explained video, before you make any other decisions with Medicare, you must first be enrolled in both Medicare Part A and Medicare Part B. This is referred to as Original Medicare, Medicare Part A and Medicare Part B. So from there, you can make one of three choices. But keep in mind, no matter which choice you make from here, you must always pay your Medicare Part B monthly premium. Your first choice is to do nothing. Just keep Medicare Part A and Medicare Part B as your insurance coverage and add a prescription drug plan, Part D. Of course, with just Medicare A and B and no other coverage, you still have unlimited financial risk should you get sick or injured. Your portion of the medical costs could still result in financial hardship. Most people are justifiably uncomfortable with having unlimited financial risk in the case of a medical event. If you want to limit your financial risk, you can either purchase additional coverage via a Medicare supplement plan or replace your original Medicare with a privatized version of Medicare Part A and B managed by a private for-profit insurance company. That's a Medicare Advantage plan. Now, there are many different types of Medicare Advantage plans, but literally 98% of all Medicare Advantage plans are constructed as either an HMO or a PPO. In this video, we will only be referring to the Medicare HMOs and PPOs and not the other types of Medicare Advantage plans. To be clear, a Medicare Advantage plan is not a Medicare supplement. It does not supplement your original Medicare. It replaces it. You still must pay your Medicare Part B monthly premium, but you're no longer using original Medicare. You don't use that red, white, and blue card anymore. The insurance company that you choose for a Medicare Advantage plan will issue you their own insurance card for the plan that you're enrolled in. So the new Medicare Advantage card is what you use when you seek medical care. Now, as you may know, original Medicare has a lot of copays and deductibles. Each Medicare Advantage plan has its own copays and deductibles, and by law must be designed as an actuarial equivalent to original Medicare. Actuarial equivalent, that's an interesting term. What exactly does that mean? It means that on average, the person on any Medicare Advantage plan must have roughly the same out-of-pocket expenses as if they simply had original Medicare Part A and Part B and not added a supplement. Unlike a Medicare supplement, every Medicare Advantage plan is different from each. Each has different coverage, each uses different doctors and hospitals, and every Medicare Advantage plan can and will likely change its benefits each and every calendar year. But by law, they must remain an actuarial equivalent to original Medicare. However, as I mentioned earlier, Medicare Advantage plans have a maximum limit on the policyholder's annual financial risk, also called your maximum out-of-pocket expense. Now, if you have a pen and paper handy, this is an important Medicare insurance term that you should be aware of as you research your Medicare choices. The term is your annual maximum out-of-pocket expense, fondly referred to as your MOOP. Your MOOP is the most money that you'll be liable for in medical bills for any inpatient or outpatient services during any calendar year. It's a great way to measure the coverage of one health insurance plan versus another. The plan with your lowest MOOP has the most insurance coverage because your financial risk is the lowest. Once your out-of-pocket expenses has reached your MOOP, you have 100% coverage for the remainder of the calendar year. All other Medicare-approved bills will be covered by 100%. Just remember, your MOOP resets on January 1. It is a calendar year maximum out-of-pocket. So come January 1, it resets and starts all over again. It's important to know that your MOOP never includes your premium purchase of the plan and the cost of prescription drugs. Prescription drugs are always separate. The next concept is, I believe, the most important concept to understand when considering a Medicare Advantage plan versus your other choices. If a private for-profit insurance company is going to provide you roughly the equivalent health care coverage to original Medicare, but add a cap to your financial risk and then cover 100% after you've reached your MOOP, what do you have to give up to receive that benefit? You must give up something. Nothing is for free, and I've never known an insurance company to be philanthropic with its business. What you give up are the unique benefits of original Medicare. There are two unique benefits to original Medicare that you give up when you enroll in a Medicare Advantage plan. Now, the first is that with original Medicare, you can see any doctor, go to any hospital in the United States or its territories, and as long as they accept Medicare assignment, your cost will be the same. With a Medicare Advantage plan, you're either restricted to just local doctors that accept your insurance plan and have no insurance coverage outside of those doctors, or you can see doctors outside of the network, but at a higher cost and a significantly higher MOOP. Second is that original Medicare intends to cover every medical procedure or service that's medically necessary and relies on your doctor's opinion, your doctor's diagnosis to define medical necessity. You and your doctor control your health care. With a Medicare Advantage plan, the insurance company gets to define medical necessity, and they don't even ask your doctor. Every procedure must first be approved by the insurance company. Now, if you're still with me and following, there are two very important pieces of information that you should have if you're deciding if a Medicare Advantage plan is right for you. In 2018, on a witness stand in Southern California, a former medical director for an insurance company stated that, per his employer's guidelines, he never looks at a patient's medical records when deciding to approve or deny medical services. In addition to this particular case, he admitted that he had no knowledge of the symptoms or treatment for the disorder that he had denied authorization for. As you let that sink in, below in the video descriptions I have a link to the article on this story and the research facts that I shared. You can research and confirm everything that I'm saying and about to say. So also in 2018, the Inspector General for the Department of Health and Human Services, the government department that oversees Medicare, released a report on Medicare Advantage plans. He researched 3 years of Medicare Advantage plans from 2014 through 2016. He found that in each and every year, between 51 and 56% of the people on a Medicare Advantage plan were denied necessary medical services and harmed in the process. In addition, he found that insurance companies regularly failed to inform the policyholders that they had the right to appeal and failed to provide them with the material and information that they needed to launch an appeal. After statistical analysis, he concluded that insurance companies denied necessary medical services purely to increase their profit margin. Again, like all my other source material for this video, I have a link to the Inspector General's actual report below. So far in this video, you've learned that when you enroll in a Medicare Advantage plan, you give the insurance company say over what coverage and service you receive. Your doctor no longer has control over your health care. You've also learned that just more than half the Medicare Advantage policy holders out there have been denied necessary medical services by the insurance company. So next, let's look at what kind of person chooses or needs a Medicare Advantage plan. But before we do, I'd like to ask that if you find this information helpful, albeit disturbing, please press the like button below and consider subscribing to my channel and see my other videos. And of course, also please leave a comment or question below. I will answer your questions. When YouTube ranks these videos to decide which ones are displayed and easy to find, they look at how many people pressed the like button, subscribed, and commented. So when you do this, you actually make it easier for other people to find this video and get their Medicare Advantage plans questions answered for them. And you may have noticed, by the way, I don't monetize these videos. There are no advertisements. I don't generate any income by your watching this video. I make these videos to help you understand your Medicare choices and the advantage of working with me and my agency. So at this point, I would expect that about 7 out of 10 people watching this video would have made up their mind that a Medicare Advantage plan is probably not the right way to go. If so, please use the link in the upper left to see one of my videos on the different Medicare supplement plan choices you have. For the rest of you, back to Medicare Advantage plans. What I'd like to do is first define and compare an HMO to a PPO, and then let's look at the demographics, who typically chooses a Medicare Advantage plan. And then we're going to go over your Medicare rights and the 3 enrollment periods for Medicare Advantage plans. Let's start by reiterating that all Medicare Advantage plans are different. Most insurance companies in this market have multiple Medicare Advantage plans. Each of them are different from the other. Now, I often hear people say, I have Humana, or I have AARP, United Healthcare, or Aetna. Those are insurance companies, not plans. Each of those companies has multiple HMOs, PPOs, special needs plans, fee-for-service plans, Medicare Part D, prescription drug plans, Medicare supplement plans, and so on. So instead of thinking of these plans by insurance company, first think of them as either an HMO or a PPO, and then by insurance company or the insurance company managing the plan. So let's start by stressing that all Medicare Advantage plans are annual contracts. Every Medicare Advantage plan ends on December 31st of each and every year. Once you enroll in a Medicare Advantage plan, you're obligated to it for the calendar year, with some exceptions like if you move. Let's talk first about a PPO, though. PPO stands for Preferred Provider Organization. Now, this is a type of health plan that contracts with Medicare providers, such as your hospitals and doctors, to create a local network of participating providers. And you pay less when you use a participating provider that belongs to your network. You can see providers out of the network, but it's at an additional cost. These plans are typically local, with a network that includes doctors and hospitals in your county or surrounding area. There are also some regional PPOs that might encompass an entire state or group of states. You will likely have a primary care physician with a PPO, but you can see any doctor or any specialist you choose, and you don't have to ask permission to get a referral to see another doctor. These plans have one set of fees and a MOOP if you use your in-network providers, and then they have a higher set of fees and a higher MOOP, a much higher MOOP, if you use out-of-network providers. For example, maybe your plan charges you a $25 copay to see an in-network doctor and a $50 copay for out-of-network. Or you're going to pay something like $50 for an in-network lab test, but 50% of the medical bill if you go out-of-network. Now, those are made-up numbers. They're just to illustrate the difference. What's not made up is the year 2020 MOOP set by Medicare. So for 2020, the annual maximum out-of-pocket threshold for a Medicare Advantage plan is $6,700 for in-network services and $10,000 for out-of-network. That's the maximum. Some plans have voluntarily set their MOOPs lower. The maximum is set by Medicare each year, and the number can change, but it's held that rate since 2010. Now, understanding the network is important when shopping for Medicare Advantage plans. It's also important to understand that the network can change at any time, so you may have to change doctors in the middle of the year to avoid paying out-of-network costs. Linked below is a report by the Kaiser Family Foundation that states that on average only 46% of the doctors in an average area even accept Medicare Advantage plans. Now, some of these doctors are going to accept Medicare HMOs, some PPOs, some both. Just because a doctor accepts Medicare Advantage plans doesn't mean they're going to accept your Medicare Advantage plan. In addition, when you enroll in a Medicare Advantage plan, you're committed to staying in that plan until December 31st of whatever year it is. The doctor can drop your insurance company at any time. They can stop accepting your Medicare Advantage plan in the middle of the year. Your only recourse is to find another doctor or pay a higher fee. Now, there is an exception to this in that if Medicare finds that there was a significant disruption in a Medicare Advantage plan's network, they may provide you with a special enrollment period to go find another Medicare Advantage plan. Unfortunately, I can't find a specific definition of significant disruption, but I'm pretty sure it's not it's not one or two doctor changes. So let's talk about HMOs. Now, HMOs stand for a Health Maintenance Organization. An HMO will typically have a much lower MOOP than a PPO. Typically, an HMO may have something like a $3,400 a year MOOP. Some will have less. A lower MOOP means more insurance, right? If you've learned anything from this video, it should be that if an insurance company is going to give you something, there's a cost for it somewhere. There's no free lunch. So what price do you pay for a lower MOOP? There are two extra limits that are placed on an HMO policy to HMO policy holders to help pay for that lower MOOP. So first, with an HMO, you have no insurance coverage outside of the network. None other than emergency treatments, and I'll get to that more in a moment. But understanding their definition of an emergency treatment is very important. If you see a doctor not in the HMO network, you're going to pay the full cost. You have no insurance coverage, and your MOOP doesn't apply to out-of-network medical bills. Now, some very small HMOs that don't have all the required specialty care providers contracted with them may offer out-of-network care for that specialty, but that's an exception to the rule. Second, like a PPO, you must have a primary care physician. But with an HMO, your primary care physician controls your health care. The HMO primary care physician is likely to be paid a bonus for controlling insurance costs. They control insurance costs by limiting your care. If you want to see a specialist, you must have a referral. In a Medicare HMO, you're not allowed to go see any doctor in the network without your primary care physician's approval. Obviously, your lower MOOP comes with a lot of restrictions. I don't know how many of you may have seen the hit TV show about Breaking Bad. It first aired in 2008. The entire premise of the show is this high school chemistry teacher is diagnosed with stage 3 lung cancer. His insurance through the school system is an HMO. The doctors that can save his life are not on his tiny HMO network. His life depended on him getting enough money to pay for treatment on his own. 100% out of pocket, no MOOP. So he turned to manufacturing meth to make enough money to get the cancer treatment that he needed. So, other than drug manufacturing, that show had a very accurate depiction of an HMO. By the way, if you remember that from Breaking Bad, please let me know. Leave a comment below. I just want to know if people can relate to that analogy or if I have to find another one. All right. Last thing about an HMO. It has to do with the emergency services coverage. All your HMOs will have coverage for emergency and urgent care services when you're traveling to other states or places where you're out of network. But even most insurance agents don't know the definition of emergency services that these HMOs use, and it can be difficult to find in the literature that you're typically provided. An emergency is when your life is threatened. Once you're stabilized and your life is not at risk, all the other non-urgent medical services are non-emergency, they're not emergency, they're not covered. I was once told a story by a gentleman who I was helping to switch from a Medicare HMO to a Medicare supplement. And as he told it, he was vacationing in Las Vegas when he got into a very serious car accident. The HMO he had was based in Florida, so Nevada was certainly out of the network. Well, his HMO paid for the medical services when they pulled him out of the car and while he was in ICU. But when he got out of ICU and they wheeled him up to his room in a body cast, his insurance stopped paying. In order for his insurance to continue covering his recovery, he would need to find a way back home to Florida and stay in an in-network hospital. He was in a body cast and out of network, so he basically had no insurance. And the MOOP only applies to in-network costs. Out-of-network costs are 100% the patient's responsibility with no MOOP. In this case, a PPO would have been at least a little bit better. With the typical PPO, he would have had to pay, I don't know, maybe 50% of the non-emergency costs up to his $10,000 out-of-network MOOP. Anyway, this incident is why this gentleman decided that he needed a Medicare supplement plan. Now this is important. Let's talk about the prescription drug portion of a Medicare Advantage plan. There are Medicare Advantage plans that include bundled Medicare Part D prescription drug plans and those that don't. You cannot get a standalone Medicare Part D plan with your Medicare Advantage HMO or PPO. If you attempt to purchase a standalone Medicare Part D plan when you have a Medicare Advantage HMO or PPO, Medicare will kick you out of your Medicare Advantage plan. If you need a Medicare Part D plan and you choose a Medicare Advantage HMO or PPO, you must use the bundled Medicare Part D prescription drug plan. You cannot get a standalone prescription drug plan. Now, because all of the plans are different, if you have a lot of prescriptions, you may be placed in a position where you can either choose a plan that includes your doctors in network, but you overpay for your prescriptions, or get a plan that charges less for your prescriptions, but you might have to change doctors or pay out of network for some of your doctors. The bottom line, though, is do not get a Medicare Advantage HMO or PPO and then enroll in a standalone Part D prescription drug plan. You will be booted from your Medicare Advantage plan. So who chooses a Medicare Advantage plan? In my opinion, there are 4 groups of people who end up in a Medicare Advantage plan. And it's the last group that I'll mention here that concerns me the most. And you'll see why in a moment. So the first is those who qualify for Medicare and are under age 65. Now in most states, Medicare supplement plans are either not available or way overpriced for people under 65. There's no federal law requiring that Medicare supplement plans be offered to people under 65. So unless your state has specific rules to the contrary, they're simply not available. So that leaves a Medicare Advantage plan as the only option for most people under 65 on Medicare that want to limit their out-of-pocket. So according to Medicare, 16% of the people on a Medicare Advantage plan are under 65 years of age. Unfortunately, they will get a new initial enrollment period on the month that they turn 65, and they can choose any plan at that time. So the next group is based on income and health. 48% of the people who choose a Medicare Advantage plan are people whose income is less than 200% of the federal poverty level. Now, for a single individual in 2019, the federal poverty level is $12,500, slightly more in Alaska or Hawaii. So of these, about 1/3 have serious health problems. The third group is made up of those whose employers have penned a deal with a Medicare Advantage insurance company to offer Medicare Advantage plans to their retirees. Now, this is the fastest growing group of Medicare Advantage plan enrollees. Now, as you may know, pension plans in the U.S. are underfunded, and many large employers find that they don't have the funds to offer the promised employee benefits. So by contracting with a Medicare Advantage Plan insurance company, they can offer their health benefits at a lower cost and, well, reduce their expenses. So these are group Medicare Advantage plans, but they still have all the characteristics that I've described earlier in this video. So if you are offered one of these group Medicare Advantage plans, at least now you can make a decision with your eyes open. So the last group of people choosing a Medicare Advantage plan when they enroll in Medicare is the one that I've witnessed most often, and I speak with them on the telephone almost every day. I read their posts and forums on Facebook, and these are people who don't do their research when they first enroll in Medicare. Now, typically they invite some agent to their home. Often it's a captured agent who's employed by an insurance company, or one who claims to be independent but in practice just isn't. So the agent shows up, opens up a few glossy brochures and shows them the local HMOs and PPOs, and never even mentions a Medicare supplement plan. You see, Medicare Advantage Plan commissions are set by Medicare and are typically 2 to 5 times more than what an agent will earn offering a Medicare supplement. Even more, the commissions on a Medicare Advantage plan continue every year as long as you have a Medicare Advantage plan, and they also increase each year with inflation. Contrast that to Medicare supplement commissions, which last only about 6 years in most states and never increase. As I mentioned in one of my other videos on using an independent insurance broker, you should first consider the various Medicare supplement plans, and only if one doesn't fit both your needs and your budget should you then consider the Medicare Advantage plans that are available to you. If an agent shows up and shows you a Medicare Advantage plan before even discussing Medicare supplement plans, in my opinion, they're more interested in their commissions than your health care. So in this situation, the consumer's never educated on their options and has no idea what other options were available to them. They don't know the pros, the cons, the consequences of their choices. They're just not an informed or educated consumer on Medicare. Now, I know this has been a long video, and I have just 2 more very important points to make. But if you are considering a Medicare Advantage plan, please feel free to reach out to my office. We will make certain that you make an informed decision and get into the right plan for your needs and your budget. So let's talk about enrollment periods. Now, many people confuse the Medicare Advantage enrollment period and believe it's the same as the 6-month Medicare supplement plan initial enrollment period. It's not. Now, there are several common enrollment periods for a Medicare Advantage plan. The first is your initial enrollment period. Now, this is the same initial enrollment period that you have for Medicare Part A and Part B. It's your birthday month and the 3 months before and the 3 months after. The exception, of course, is for people whose birthday's on the first day of the month, and then everything is moved forward by 1 month. You can see my How to Enroll in Medicare video for details on that. If you miss your initial enrollment period, you can enroll during the annual election period, also known as AEP. And this is from October 15th through December 7th of each year, with your Medicare Advantage plan starting, of course, in January when you do that, January 1. So next is the open enrollment period. Now, open enrollment is the first 3 months of any calendar year. But the only things that you can do during open enrollment is make one switch. If you don't like your Medicare Advantage plan, you can make one switch during that time period. Or you can move from a Medicare Advantage plan back to original Medicare. If you have a Medicare Advantage plan and you move out of state or out of that plan's service area, you have a 63-day window to get a new Medicare Advantage plan for your new local service area. 63 days, that's all. Then there's also the 5-star plan special enrollment. If there's a 5-star plan in your area, you can switch to it once each 5-star period. That's a period from, get this, December 8th of one year through November 30th of the next year. Now, as you wrap your head around that odd period of time, I think of it this way. The only time that you can't switch to a 5-star plan is the first week in December. Medicare loves their rules. There may be other state-specific rules, but those are the most commonly used special enrollment periods in your initial enrollment for a Medicare Advantage plan. So last but not least are star ratings. When used properly, star ratings, they can be a great tool to evaluate the quality of a Medicare Advantage plan. So every year, Medicare interviews the consumers, the doctors, the pharmacists, and asks them certain questions about their experience with the various Medicare Advantage plans. And then, in their Medicare Part D plans, of course, but then they compile the results into a star rating so that you can then determine which plans are more likely to provide you a better experience. The star ratings are ranked from 1, the poorest, to 5, the best. And Medicare assigns an overall rating, but much of the average rating has nothing to do with customer service. So on the Medicare website, you can actually review the details that make up the star rating and make more of an informed decision about whether that plan will be worth committing to for the year. So when shopping Medicare Advantage plans, it's strongly advised that you consider the star rating. It can be a great tool to filter out the insurance companies or the plans that are not up to par in how they treat their customers. Just remember, it can change each year. Now it's your turn. I make these videos for you. Please, leave me a comment below and let me know what part of this video that you found the most informative or that you plan on using when you shop for your Medicare. If you have a question that I didn't answer, ask it below and I will respond. I'm really interested in what you have to say. So I hope you found this informative and helpful and have enjoyed our Medicare Supplement Plans Explained video. If you believe others will also find this video helpful, please press the like button on this video and press the thumbs up for me if you found this information helpful. See, when you do, you're actually helping other people that are also researching Medicare find this video. So the more people that like, comment, or share the video, the more likely it is that YouTube will show this video to others who are also researching their Medicare options. So if you want more, of course, subscribe. I have over 40 other videos that are on different subjects on Medicare. So I'm Matthew Claassen. I'm with MedigapSeminars.org. Thank you very much for watching.